Joplin, Missouri isn't just a town. It's the heart of a resilient community. The people of Joplin have weathered storms and hardships. But in the face of adversity, this remarkable community always finds a way to rise together. When the people of Joplin need a helping hand, we answer the call. My name is Stephanie Brady. I'm the Executive Director of the Community Clinic of Southwest Missouri, and I've been here for 7 years. So this year we're celebrating 30 years at the clinic. So we were founded 30 years ago and have been providing care ever since. The mission of the clinic is to provide care for those without access to care, specifically healthcare, dental care, and mental health care. We were initially founded at an outreach building at the Presbyterian Church downtown Joplin. We had several doctors in the community who saw a need for individuals who didn't have access to health care, and they really wanted to improve the opportunities for those individuals without insurance to be able to receive health care that would improve their lives. As we've grown, we were able to hire some small staff, and then as we've continued to grow, we have a full staff of a nurse practitioner, 2 nurses, a medical assistant, and then additional administrative staff. So we still have a significant number of volunteers who provide health care on a daily basis, and they're volunteering their time and resources and expertise to ensure that our patients have the best quality care possible. As the clinic continued its steadfast commitment to the community, a monumental challenge awaited us in 2011 that would forever change the town.
A devastating tornado tore through Joplin, Missouri, leaving a trail of destruction in its wake, and the community left to pick up the pieces.
The destruction was through a huge swath in the middle of the community. For a long time it was known as the chili pepper because it really looked like a chili pepper going through a community of devastation. About 80% of the medical infrastructure was destroyed. We had 2 schools destroyed. We had a private school destroyed. A lot of our general infrastructure in the community was destroyed. We did lose 162 lives, and then we had 18 suicides that were directly related to the tornado in the months after the tornado happened. And in terms of the clinic, at the time of the tornado, we were able to provide some triage. We did a lot of tetanus shots for people who were going through the rubble. We were able to connect a lot of individuals to additional health care, but in those early moments after the tornado, our hospitals were really taxed. One of the hospitals was severely damaged, and the other hospital was trying to manage all of those emergency needs. So a lot of the people that we saw after the tornado were those individuals who had minor issues. They had cuts and scrapes, general issues. They might have some PTSD, and they were just really stressing and afraid of the situation. Whenever FEMA came in, they told us, expect to lose at least 25% of your population. They'll leave, they won't come back, and you'll lose that infrastructure. There was a whole swath through the community that it wasn't just damaged, it was completely gone. So we really had to work to rebuild. And when FEMA told us to expect 25% of our population to leave, at the end of the day, we only lost 2% of our population because we're a very resilient community. We wanted to build back, and we wanted to build back not just to the status quo of where we were before, but we wanted to build back better. So we have some really great programs that have targeted the individuals who are lesser income, the individuals who are struggling to make ends meet. And we have a lot of programs that were really designed to help them get through the tornado and then to thrive after the tornado. If you drive around the community, you will see beautiful butterflies on a lot of the businesses, in the parks. They are a symbol of our resilience, a symbol of people coming together, and then they're also a symbol of the stories that came out after the tornado initially hit. We had children who were reporting a winged person that was coming to save them. We had children that should not have been okay, and their response was, a butterfly saved me. It wasn't 1 or 2 accounts of that. We had 50 or 60 counts of that. It's a constant reminder of where we've been and how we were able to overcome that and move forward. We had had some years of the clinic where we weren't providing as many services, and about 6 or 7 years ago, we really started to expand those services more. We decided to have a butterfly on our building. We really wanted to also show our commitment to the community, showing that our community clinic is strong and resilient and that we're going to continue those services. We really wanted to show our own resilience, and we wanted to show our connection to our community. On an annual basis, we serve over 2,000 unduplicated patients, and that equates to about 10,000 individual visits for our patients. And our patients are 100% uninsured. They are people who are the working poor. They are struggling to make ends meet. They are not eligible for Medicaid because they make too much money, and they can't really afford marketplace insurance, so they're in that coverage gap. So our patients are really needing a lot of those additional services that we added because they're not able to access those in the community. They come here to get care, but in addition to getting care, they have somebody who listens to them. They have somebody who is on their side, who's advocating for them, who's helping them to ensure that they're able to take care of their family, that take care of their children, and be able to work without having to worry about their health care. So we're able to provide them quality health care at no cost to them. They're able to get prescriptions from us, they're able to get lab services, and we also partner with both of the hospitals in town because we divert so many people away from their emergency departments, so that really helps in the long term. The clinic serves a quite large area. We're all throughout Southwest Missouri, and we also provide services in Southeast Kansas. Officially, we have about 9 counties that we serve, but in reality, if we have a patient who is able to get to the clinic and they're needing care, we're okay and we're going to provide that care, even if they don't live within that realm of counties. The reason why we really wanted to get a mobile medical unit, we've always felt like we needed one. And we've always sought opportunities to get a van, but it had just been not affordable for us. As a free clinic, we are on a tight budget, and we really decided about 4 years ago that we were really going to make this into fruition. And we were really blessed this year to be able to partner with the City of Joplin through a community development block grant that was able to provide us the resources to actually make that dream into reality. We want to provide more care to those people in rural communities. We have people who are trying to get to the community clinic, but it could be an hour to 2-hour drive for them to get here. So with the mobile unit, we really are focusing on those rural communities, being able to take medical care to them. They want to continue living in those rural communities, but if they don't have access to health care, it can become an issue for them. So with the mobile medical unit, we are able to go out to those communities. We go down to McDonald County, which is a very rural area, and we're able to provide breast exams for women in need. We're able to go to counties in Kansas and provide necessary vaccines for the patients that they are seeing. We're able to do primary care as well. We're able to provide assurance to those families that they're getting the care that they need. And we're also partnering with the medical school to be able to provide a lot of that care through volunteers and provide a lot of those resources to those people in the communities. We realized whenever we did get the funding that we had to make sure that we were able to do everything that we wanted to in that van. And what AVAN was able to provide for us, we were able to ensure that we'd be able to provide that care in those rural communities. The price was better than the other bids that we received, but it also had a lot to do with how they were going to be able to build it out exactly the way that we wanted to. We were able to work with Walter and Simon at AVAN, and they were able to provide us with guidance on how to develop exactly what we wanted in that vehicle. They listened to us and they listened to our needs, and it really did prove to us that they were the company to go with. It's amazing how all of the things that you would need in a regular exam room are there. We're able to have a refrigerator, a sink with running water, electricity to the back. We even have a desk in there, lots of storage. We're able to provide all of the things that we need to run an actual clinic we have there. All we had to do was go in and plug in our testing equipment and fill the bins, and we're ready to go. The ways that this van will help us as a community clinic, we're going to be able to reach so many more people. If you are able to take medical care to the individual, they're more likely to access that care. They're more likely to receive care. especially in those rural communities. We have people who don't have transportation to come to our clinic. They don't have the resources to get here. And a lot of times they don't think that medical care is necessary. But whenever you take medical care to the individual, a lot of those obstacles get moved to the wayside. They're no longer obstacles for them. So we're able to really ensure that all the people that are in need are going to be able to get that care. So we're going to expand our numbers, we're going to expand our collaborations, we're going to be able to expand our services. At the heart of our mission lies a burning commitment to forge powerful alliances. Our relentless pursuit of quality, affordable healthcare for all knows no bounds. With this new mobile medical unit from AVAN, the community clinic doesn't just aim for new heights, it's soaring toward a future where compassion and care unite to transform lives. Together, we're turning dreams of better health into reality, one patient at a time.
Thank you for watching. If you enjoyed that one, here's a couple more you might like. And if you really liked it, be sure to subscribe so you can find out when the new videos come out.